welcome. Today we have Breanna McLintock, who is an ER nurse, to tell us what it's like to work in the ER. Thanks, Breanna.
Hi.
So tell me, as an ER nurse, what does that mean?
So we will see people come in after an ambulance picks someone up, or sometimes people just come right in through our front doors with illnesses or accidents as well, I guess.
So what does it mean, like, for you as the ER person? What is your role in taking that patient back and getting them to see the doctor?
Okay, so when a patient presents to our front desk, let's just say, we kind of determine how serious they are, and meaning how sick they are, and if it's something that's very serious, let's say they're having symptoms of having like a heart attack or a stroke, we try to get them back as quickly as possible, and do everything for them as quick as we can. It kind of depends too a lot on how busy our department is. If somebody's had abdominal pain for, let's say, a month, and then they're coming in, sometimes, not that they're not important, it's just that somebody walking in with heart attack symptoms are going to get seen faster. So we have what we call standing orders. So this means that a team of our nurses and doctors and administration staff all get together, and they make these orders that nurses can carry out without necessarily having a doctor see them first. So this means that we can get lab draws right away, we can get an EKG right away, we can even get you life-saving medications if you need to, before a doctor can even make it in the room, because sometimes that happens.
And so as an ER nurse, are you a RN registered nurse? Are you a 2-year registered nurse, a 4-year registered nurse? How does that play into what you're doing?
So I went to, for my ADN, I went to Northeast Iowa Community College in Calvert. And for my bachelor's, I'm going through Liberty.
Would you say that it takes a lot of fight or flight or adrenaline to do a job in the ER?
Well, I think that kind of comes naturally to you when you are faced with something. You just get in and you do what you need to do, and then you kind of process it later. Everybody has a different personality type, and in just looking at our department, we have a lot of very strong, headstrong type, assertive people, and that's great, but we have some very laid back, quiet, and almost shy kind of people as well. So you don't have to be a certain kind, you just have to love what you do.
And be able to make those time sensitive decisions and make the right call.
Right. Yep.
Would you be able to describe kind of the atmosphere among the ER in regards to teamwork and working together and respecting each other a little bit?
Yes. So I have an amazing team, and I can't say that enough. If we can go from picking on each other 1 minute and laughing and having a good time to a patient coming in and they're like, oh no, we need to get to work, and everybody has their game face on, and it's, from an outsider, it looks chaotic, but to us it's organized chaos. Everybody has a job, they know what they're supposed to do, and we don't just get thrown into this, we practice this stuff all the time too. We go through several times a year, we go through different training scenarios to make sure that we're always at the ready.
And would you say that those scenarios train you well and you're well equipped for an emergency like that?
I believe so. Although I do believe that there is no teacher like experience. We can pull all of the training scenarios we can out of our hats and try to play everything out. But the truth is, every situation is different, and everyone reacts differently. And so, like I said, the best the best training is actually getting in there and just doing it.
That brings up a good point. So how did you work your way into the ER? Did you start somewhere else? Were you a CNA? How did this happen?
So it's kind of a funny story, actually. So when I was 15, I knew that I wanted to join the Army. And everybody told me that I couldn't do it. And I am a very watch me kind of a person. If you tell me I can't do it, I'm going to prove to you that I can. And so when I went to go take a test, the ASVAB test, they said, well, you're fit for certain jobs. And they said, oh, well, a medic would be a good one. And there's another one too that I was kind of interested in. And it kind of just happened. I didn't really know at the time, but when I started working into it, like I was an Army medic for 4 years. I was an EMT. I was a medical assistant, and I kept coming back to this emergency medicine piece. There's something about that I just craved always.
And so have you been in this ER nurse job very long, or was there a different path to get?
I've been in this role for about 5 years. I actually started on a med-surg floor, which this is a really good piece of advice too. We might get to that later, but this is a good piece of advice. Start on the med-surg floor, get your feet wet, learn your priorities, and then go into a more specialized area of nursing. So I did my first year like that. As much as I grumbled about it, I really didn't want to do it. My organization that I work for now said, no, we really want that year under your belt. And I'm really, really glad that I did, because I came into the ER just with that nice foundation of nursing.
Yeah. And that's where that experience helped to decide that path for you, like you were talking about getting experience.
Yep.
So you've never been a CNA at all? You've always had that further degree?
Yes. Well, so I was an Army medic, and I got my EMT basic, and then I worked as a medical assistant for a while. And so when you go through nursing school, you actually have to complete the nursing assistant program as part of the nursing curriculum. And so, I mean, I technically was a CNA, I just did not work as one.
Practice. What would you say is the benefit or the reason that you continue to work in the ER and not move to a different department?
It's hard to describe. Like I said, I've always wanted to come back to this. I've always just craved this. There is something about someone walking in, and in their moment of crisis, I can step in and do something for that person.
So you like the ability to help, I'll say.
Yeah. And I kind of like the adrenaline rush too a little bit. I mean, if I'm just being honest, I kind of like it when, not that I want it to happen to everybody, but it's like, okay, let's go. We have this, this person that's probably having a heart attack. Let's get in and get started, and everything moves really quickly, and it's kind of fun to me.
Yeah. If you were to look at going elsewhere, what opportunities would be allowed given your degree and background in the ER? What would be a next step for you?
So I have to finish up my bachelor's. So no matter where I go, I mean, to advance beyond this, bachelor's, either way. I really love bedside nursing. I could potentially see myself maybe teaching, but I don't know yet. I've not found that calling yet. Right now, I'm just focused on bedside nursing.
And what would you say would be the soft skills or the interpersonal skills that a person should have to be a nurse in general? they wanted to help somebody like you are?
Communication. Yep. Communication is huge. I think that tops every other skill that you can have. You can learn all of the technical skills. You have to be able to communicate firmly and respectfully. I think that's very, very important. A lot of times there's not time for hurt feelings or being upset about things. You just have to do what is right for the person that is in front of you that you are taking care of.
Mm-hmm. And so if I were a 16-year-old, like those are the kids that are going to watch this, 16, 17-year-olds that are kind of clueless, not sure what they want to do, what advice would you have for any of those people about their career path? Maybe a nurse, maybe not. What would you suggest they do?
Sometimes things fall into your lap by default. You don't, like, if you have a passion for something, go for it. And if it's not working out, that's okay too.
So go try and experience.
I guess that's all I have.
Okay.
Yep. Yeah, and so there are a lot of hospitals. I can't think of one that wouldn't let you come in and shadow for a few hours. You know, you have to sign a confidentiality thing that, you're bound by confidentiality, of course, but go in and just, you can see if you like it or not. Sure, many people are, so there's lots of people that you can talk to in nursing. There's family medicine, there's neurology, there's orthopedics, there's so many different specialties that you can go into.
Mm-hmm. Okay. Well, thank you for your time today. I appreciate your knowledge and sharing your interest in that field.
You bet.